When you think about ADHD, you often think about the childhood diagnosis, maybe the hyper kid in the elementary or middle school classroom. You know, few of us fall into that category. But for adults, the hardest part comes after the diagnosis, right? So I'm happy to be joined this morning by Dr. Dania Antalaya Thomas, public health epidemiologist and adult ADHD empowerment consultant in Atlanta. Well, it sounds like you're the perfect person to talk to, Dr. Thomas. Thank you for your time.
Good morning, Mr. Kennedy. How are you doing? Good morning, everyone.
Good morning.
How is your day going so far?
You know what? Day's going great. I've been up since 4, so we're just zooming through the day, but I love the early morning
Yes, sir.
hours. So thank you for asking.
Okay,
Let's
you're
talk
welcome.
about ADHD and what it means for adults. What does it actually look like? Because I mean, really, we usually all think about children, right?
Yes, definitely. Okay, so when most people think ADHD, like you said, you think childhood. But guess what? ADHD does not disappear. So it follows you into adulthood. This would look like burnouts. Sometimes, depending on how you parent your child or children, you'll get agitated easily. You'll forget things. You'll just miss deadlines. That's mainly how it shows up in adulthood.
Yeah, are there also adults out there who were never diagnosed as children? I'm thinking maybe like the 50 plus generation. I mean, was ADHD a taboo subject when they were growing up and not really diagnosed?
So it's so funny you said that because according to the CDC, at least 6% of the US excuse me, 6% of the adults in the US alone, that's about what, roughly 15.5 million people that have been diagnosed as an adult. And more than, no, they've been diagnosed, period. But more than half of that have actually been diagnosed in adulthood. So that's where I come in because then what's next? You get your medication, then you don't know what that means because once again, it's always talked about in childhood. So that's why I'm here and that's how I will come in. Because when adults are diagnosed with ADHD, their struggle is what next? Most workplaces, most schools, most institutions, they're looking for what? Memory, consistency, right? You're looking
Hmm.
for stuff like that in the workplace and in schools. But guess what? That's not the kind of brain that we have. And that's why with Dania Antalaya Consulting, what we do is try to create those tools that are main for, excuse me, that are specifically for your brain function. Because guess what? We are working in a system that does not fit this brain. Because guess I'm ADHD as well. I was diagnosed as a child, but that was with my mom. But as I got older as an adult, it started to surface itself, and I was so inconsistent and not doing things well. So for that reason, I could not find the resource, so I became the resource.
So you're working with adult professionals trying to navigate the workplace after they discover they have ADHD. Do you find there are
Yes, sir.
certain workplaces or careers that are custom suited to somebody like that?
Oh my God, epidemiology. Like data, because people like myself, we don't think in straight lines, we think in constellation. So for that reason, sitting down and hyperfixating on even coding, I love coding, stuff like that. Because once an ADHD person sits down with something that they want to do, they are so into it. They will take 2 hours for something that they have been trying to do for 2 whole months and 2 years.
Hmm.
So yes, if you're doing stuff that will take a little bit more time, then it's very good for people with ADHD.
I throw out TV news, by the way. We also live in like 4 minute segments, so we get to cover a variety of issues all day. It's a lot of fun. You know, somebody's watching
Oh
and
wow.
said, and they're saying, you know, this sounds like me, but I've never been diagnosed. What next steps should they be taking, doctor?
Okay, well, let me just say first of all, although there's doctor in front of my name, I'm not a psychologist, I'm not a psychiatrist, and I'm not a licensed professional. What I am is somebody who has lived it. So for that reason, even if you have not been diagnosed with it, you might have ADHD like symptoms. You might be forgetting stuff, like I said. That's the number one thing. Like, for example, I will leave you with three simple things that people can take away today. Number one is getting out of your head. The fact that you can't remember things, you have to jot it down. So, like when you're at work or when you're at school, write the things down. Create alarms, create schedules that you have to do. Like right now, I have boards on my wall. It doesn't matter what, even if it's a dental appointment, I write it on my board. Why? Because with ADHD, we're in our head and we have to get out of that and remember, try and remember things, but you're not going to. And if you don't remember things, guess what? That leads to stress. And stress is going to amplify your ADHD. And that's what we're trying not to do. Right? So, and number two, I want people to start small. Mr. Kennedy, I need everybody to start small. I know that it takes a task. For example, you have 8 steps that you need to take in order to accomplish something. I need you to forget steps 2 through 8. We're going to only focus on one. Start small on purpose. Don't over exert yourself, right? And the last one I want everybody to be left with is work with the energy that you have. With ADHDers, I like to say ADHDers, we have so much energy. Sometimes your energy is in the morning, sometimes your energy is in the afternoon. Whatever time it is that you're at the highest, do your most important work first. Do the hardest task, because then you're going to exert all that energy and hyperfixate on that task. So even if it is that you're not finished it, guess what? You finished a portion and you're further than you were yesterday, weren't you? Yes, sir. So that's where I come in. I just want to teach people you're not broken, guys.
Yeah.
Just come to me and let me create some tools that will help you not fix, let me remove that word. We're not fixing anything. We're just creating a system that works best for ADHDers.
If I'm understanding it correctly, you're leaning into it, you're embracing it because in a way it's a gift.
Yeah, it's your superpower, Mr. Kennedy. It's your superpower. It's not a limitation. We've been told so much that we need to break free from all that we have, the stigma, the negative thoughts, breaking free. And that's why I had this book right here. It's 6 of us, and we're talking about breaking free from everything and going into entrepreneurship. So I teach that as well, Mr. Kennedy, because I know ADHDers want to do something with themselves. Come to me, guys. I got you.
Dr. D, thanks so much. How can we come to you? How can we get in touch with you if somebody's interested?
Yes, thank you so much for asking. Adultsmanagingadhd.com. That's it. Adultsmanagingadhd.com. And that has everything on there, all my social media. And everything on my social media is Dr. Dania Thomas.
It's a great conversation, Dr. Thomas. Dr. D, we appreciate you joining us today.
Thank you so much. You have a wonderful day.